Well, thank you for that warm welcome, Bill. It's a great pleasure to be here with you. I have such great respect for your organization. Here is your 6th annual conference, and really bringing in a holistic perspective, therapies that might be overlooked, well deserving our attention, and further empowering the identified patient. It's a wonderful organization, and I do thank you for the invitation. And also, thank you to the organizing committee that have made me feel so welcome, such an informal, gracious gathering. What I will do for you here today is present you with an overview of the science of mindfulness. Clearly, one could present on the history of mindfulness going back perhaps thousands of years. Certainly in the East, a long-standing tradition of mindfulness. Also, interestingly, in the West, the contemplative practices, too, we see mindfulness. But today, we're a scientific gathering, and I will offer you the science of mindfulness. And when I'm saying the science, of course, that's a big topic. But what I will do for you in these next 50 minutes is offer you an overview of the research studies that have been investigating mindfulness as a therapeutic intervention. And I'll start us off with the general science, but very soon I'll move to the conditions that have brought us here today, looking at the neurological conditions, most especially multiple sclerosis, Parkinson's disease, and also cognitive decline, mild cognitive impairment, even dementia. There may be a role for mindfulness here. And just give you a little bit of my background so you can put me in my place. Bill has already given you something. I'll tell you a little bit more. I am indeed from Toronto. I began as a family doctor in the 80s, but very soon in my career I became interested in psychotherapy, and from that developed an enduring interest in what could be called mind-body medicine, the interaction between mind and body. I've had quite a bit of education, training since those years in the 80s. Most especially at the C.G. Jung Institute in Zurich, and also through the Center for Mindfulness at the University of Massachusetts. Here you see the website of the clinic that I established in 1997. I have been teaching mindfulness through our clinic for these past 20 years. And we're a community-based clinic. We get referrals from family doctors and psychiatrists through the TGA. And for the most part, people are referred for both psychological and, shall we say, physical or medical conditions. It is surprising how valuable mindfulness can prove to be. Here you see our research page. We have a listing of over 200 research papers looking at mindfulness as a therapeutic intervention. And I'm bringing it to your attention now because as we proceed through this time together, I will be listing quite a number of research articles and papers that you may find of interest to read further. You could go to our website, ladies and gentlemen, and check out the citations listed there. And we've linked them all up to PubMed. So let's start looking at what mindfulness is. We're going to talk about meditation. Well, I would offer you that meditation is like the word athletics. Many different ways to be an athlete in this lifetime, and there's many different ways to meditate. But good research requires that we be very specific in what we're talking about. And further, good clinicians, again, we want to be specific. So here is a definition of mindfulness that serves both researchers and clinicians well. It's very popular in the MBSR world. 4 bulleted points to consider. Mindfulness means that you are paying attention, on purpose, in the present moment, and you are doing so with a non-judgmental attitude. Sure, judging can be there. We can have judging thoughts, and we can observe the judging mind in a non-judgmental way too. That may become clearer later today. If you would like to have an experience of mindfulness, I'd be happy to provide that. I think it's listed in the program, 5:30. I'll be here if you want to have a practical experience. But I'll continue, of course, with the research that I have promised you. Let's consider what mindfulness is not, because I have been teaching the program, as I say, 20 years. Had more than 5,000 people go through the clinic, so I know some of the common misunderstandings. Mindfulness is not about trying to stop your thoughts. Ladies and gentlemen, last night when I arrived, I spent maybe half an hour or so walking through the hotel in a mindful way. I was not trying to stop my thoughts, and I was not trying to enter a trance or have a special experience, and I was not trying to improve anything. That's not mindfulness. And it's odd when you're practicing mindfulness, folks, you're not even trying to be good at mindfulness. Because if you're trying to be good at it, you have judgment going on. You walk, you are present. There it is, another way of looking at mindfulness. When you're being mindful, you're simply being aware of what you are experiencing, moment by moment. In mindfulness, life takes place now. This moment, this is it. And you are allowing this moment to be just as it is. If judging is happening, you're having judging thoughts, and those are thoughts happening right now, just as it is. You're paying attention. Here's the book that began the, maybe we could call it the mindfulness revolution, bringing mindfulness, this ancient spiritual practice, into the medical mainstream. Began with a great clinician, researcher, Dr. John Kabat-Zinn. He and his colleagues at the, what was called the Stress Reduction Clinic at the Hospital of the University of Massachusetts in Worcester, developed a program which was, even in those early days, giving very impressive results. And Dr. Kabat-Zinn, a scientist by training, a molecular biologist, in fact, published on the results they were getting. And here in 1990 is the book that began to bring it to popular attention. Full Catastrophe Living. It's gone through one edition since then, but it's still very popular in our program. If you are interested in the presentation I'm offering today, you might even check out that book. And here is a graph which I found on the American Mindfulness Research Association website. Thank you to those folks. You can see on this graph the exponential growth in research publications concerning mindfulness. So on the left of the screen there, you see 1980. On the right, 2015. And what is charted is the number of research papers and articles published in mainstream scientific journals. And my goodness, it's truly exponential, isn't it? 1982, when Dr. Kabat-Zinn published his first paper. And then when I started the clinic back in 97, I think there were 8 papers published. And now, these many years later, I think it's over 650 published last year in 2015. And here's what many of the research papers are investigating, something that is called mindfulness-based interventions. Now, a mindfulness-based intervention is standardized. I teach mindfulness-based stress reduction, as I say, all these years, teaching the very same program. It's standardized. I can look at the research and assume that the researchers have also been providing the same program. And it's usually presented in a group format, although some of the papers that I'll present to you today are taught one-on-one. But again, there would still be an emphasis on a standardized approach rather than you just get an idea to teach your client, your patient, this or that. No, it's nice to follow the same protocol, again, relying on the research, which has shown what can be effective. And not to overwhelm you, we won't go through them all, but here are some very common mindfulness-based interventions. Top of the list, of course, is the grandmother program, mindfulness-based stress reduction. That's what Dr. Kabat-Zinn and his colleagues developed those decades back at the University of Massachusetts. And many of the research papers do look at the outcome of these programs, mindfulness-based stress reduction. But these days, we also see tremendous interest in mindfulness-based cognitive therapy, and we can even go further down the list, mindfulness-based cancer recovery by the great Linda Carlson, a clinician at the University of Calgary, and further down, mindful self-compassion, eating awareness, relapse prevention for addiction, and even mindfulness-based childbirth and parenting. Consciousness has power. Mindfulness is consciousness. We inform the patient how they can turn to their experience in a conscious way, and things happen. And just to give you a taste of the programs, if you're not familiar with MBSR, here is what we do. It's usually an eight-week program, and the weekly sessions are usually about 3 hours, folks, 2.5 to 3 hours. That includes discussion as well as the various mindfulness practices that I'll tell you of in a moment. And as well, the traditional MBSR approach is to have a 7-hour day of silence, a retreat. It's like going on a silent retreat. And that's usually in week 6 of the program. And further, maybe even most importantly, in fact, is our participants practice for about an hour a day at home. Sometimes that's 45 minutes, but usually it's more like an hour, guided by audio recordings. And also, we encourage people to bring mindfulness into everyday activities. You could say that's what I was doing last night as I was walking mindfully through the hotel, orienting. That's a mindfulness practice, and we call it informal practice, spontaneously being mindful. Here's the practices that we emphasize in MBSR, body scan meditation. That's really a kind of, you could call it yoga without moving, in fact, the body scan. We have hatha yoga as well, sitting meditation, walking meditation, and as I mentioned, mindfulness during daily life. Okay, so let's get right into the research now. Again, I'm going to move through these papers at a bit of a clip, but I'm so glad that you will all be receiving a DVD. So if you're interested in any one of the papers, go to PubMed and check out the abstract, the summary, and maybe even download the full paper. And again, if you need help finding the PubMed abstract, you could go to our website and we'll link you up to that paper. So here is the first paper published by Dr. John Kabat-Zinn back in 1982. I'm just going to pull up my notes so I can see more clearly here. So as you can see, Dr. Kabat-Zinn began working with chronic pain, patients with chronic pain at the hospital, and very soon caught the attention of clinicians who were impressed. Patients who for years had suffered from chronic pain were responding to an 8-week program. 2 years later, he published another paper, and then the papers began to increase, not only from Dr. Kabat-Zinn, but now dozens of researchers. So that since 1982, MBSR and the other mindfulness-based interventions have been shown to help a wide range of conditions, and there's just a few of them there. Again, if you happen to go to our research page, you will see over 200 citations covering many different conditions, including headaches, I heard earlier about that, and so on. So I'm not going to go into a lot of detail in general about the clinical efficacy of mindfulness. I think that's pretty well established. As I say now, dozens of papers indicating that mindfulness-based interventions can very much help patients with a wide range of symptoms. Further, now the research is expanding and we're becoming very interested in the biological evidence, what we term biomarkers, observing how the body is being influenced by simply paying attention every day in a particular way. Time goes by and we notice changes in the immune function. Numerous studies now showing that people who practice mindfulness regularly show evidence in the levels of their cortisol, their interleukin-6, the activity of natural killer cells, and so on. Also, the hypothalamic pituitary adrenal axis is influenced by regular mindfulness practice, and further, the autonomic nervous system, too. Lots of research now in this. I took this little summary from a paper by Dr. Rouleau, again, out in Calgary, working with Dr. Carlson there. But let's look at what Dr. Rouleau emphasizes for us. It's worth being cautious in this so that we don't get caught up in over-enthusiasm. It still remains unclear whether these biological changes translate to clinically important health benefits. Okay, so that came out in 2015. It's still true, these are early days, and we wouldn't want to cloud our vision with an over-enthusiasm, but still, it's remarkable. It's simple practice, even after 8 weeks, we can be changing even these biomarkers. And thank you, Dr. Jacqueline, for getting us ready with neuroplasticity. I'm on the bandwagon too, and here I have a definition of neuroplasticity that I got from this, you can see this review article here, Harnessing Neuroplasticity for Clinical Applications, coming to us from a National Institutes of Health workshop that was held back in 2009. Leading clinicians all gathered together, and here's the definition they came up with. They define neuroplasticity as the ability of the nervous system to respond to intrinsic or extrinsic stimuli. I guess that covers about everything, doesn't it? Intrinsic or extrinsic stimuli by reorganizing structure, function, and connections. Now, folks, that word ability, if I had my druthers, I would change it to tendency. Okay, it's the tendency of the nervous system to respond. And it can be described at many levels, from the molecular changes of the brain to cellular to systems to behavior. And again, Dr. Jacqueline was giving us much evidence of that today. So in the research papers that I'm now going to review for you, I think in the background you can see neuroplastic changes responding to mindfulness. So here's one of the very first studies of the neuroplastic changes associated with mindfulness by the great neuroscientist Richard Davidson, doing pioneering work in affective neuroscience, and he especially was looking at mindfulness. He has been closely associated with the Center for Mindfulness all these years, and now Dr. Davidson has expanded his interest into what he terms contemplative neuroscience. And here's the study done in 2003, alterations in brain and immune function produced by mindfulness meditation. So what Dr. Davidson did was he measured the brain electrical activity of 25 participants before and immediately after they attended an MBSR program. And as well, the participants were vaccinated for influenza at the end of the MBSR program. Folks, this was an elegant study. Very simple. People attending an MBSR program, and he was able to assess neural changes, brain changes, as well as immune changes. They seem to go together. So let me give you some more details. So there it was, everybody attended the MBSR program. Of course, there was a control group who were waitlist controls, and he continued his investigation 4 months after the test as well. And he reported that, I won't go into all the details, we'll be here for the rest of the afternoon if I cover all the details of each study, but in essence, what Dr. Davidson and his colleagues determined was that when people attend an MBSR program, the characteristic activation pattern of the frontal lobes tends to change. So we're not looking now at states that are induced by the practice of mindfulness. This is not a state-induced change. This is rather how the brain tends to change its function characteristically. And it turns out, those of you not so up-to-date on the neuroscience, that when we're having a positive emotion, happy emotion, the left side of the frontal lobe tends to be more active than the right. Okay, what Dr. Davidson discovered is after attending an MBSR program, participants on the whole had a tendency to activate on the left of the frontal lobe, the left frontal lobe, rather than the right. Okay, so it's a relative imbalance which exists in us naturally to be activating more to the left or more to the right, depending perhaps on what emotion we're experiencing. People attending an MBSR program will tend to, shall we say, lean to the left, and that's where the happier emotions, the positive affect, seem to correlate. So interesting, not only did we find this, did Dr. Davidson find this change in brain function, that's what we're talking of here, brain function changing with mood, and that was confirmed by some of the psychological tests that participants also completed, but as well, remember I mentioned that influenza vaccine that the participants received at the end of their MBSR program? Well, the magnitude of the antibody titers that were the results of the vaccination were higher in the participants in the MBSR program. We can understandably suspect that this means that the immune system is enhanced, that the immune system is able to respond to the challenge of the vaccine with a higher titer of antibodies than the controls who'd never been through the MBSR program. they had a lower response to the very same influenza vaccine. Fascinating and elegant. We're watching MBSR producing psychological change, neural change, neuroplastic change, and further an enhancement of immune function. So a few years on, so we're at 2005 now. Very interesting research given to us by Dr. Lazar in Massachusetts. She used magnetic resonance imaging, MRI of course, to assess the thickness of the cerebral cortex in long-time meditators. Ladies and gentlemen, these were people who'd been meditating for maybe 10 years, 40 minutes a day. I think that counts as a long-term practitioner. And she contrasted the functional MRI data from those folks. She contrasted it with controls who were meditation naive. They never did this kind of thing. And of course, the controls were well matched for age and gender, race, years of education. What Dr. Lazar found was that there were significant changes, primarily in the frontal area, between the two groups. That long-time meditators had, shall we say, thicker brains. The cerebral cortex, especially at the front, was thicker than individuals meditation naive, but of the same age, gender, and educational background. And as she made the point, quite rightly, this is suggesting to us that, or she calls it meditation, but this was mindfulness meditation. This wasn't other types. Mindfulness meditation may be able to offset age-related cortical thinning. Okay, as we go through life, no secret, the frontal lobes tend to thin. The cerebral cortex at the frontal lobes tend to thin, and it would seem that if you practice mindfulness meditation each day, you can offset that. So as she summarized for us, these data provide the first structural evidence for experience-dependent cortical plasticity associated with meditation practice. That's a bit of a mouthful. She's talking about structural change in the brain. So Dr. Davidson's work was looking at functional change. He was using the EEG, the electroencephalogram, to notice how the brain was processing emotion and found it different. But now Dr. Lazar's work is looking at actual change in the structure of the brain, seemingly associated with meditation practice. And here's 3 other subsequent studies. You know, ladies and gentlemen, I could have added quite a number here, but our time is limited, so just touch base with you around the excellent work of Dr. Holzel, who has looked at, well, there's her first, well, she's done a number of studies even before this one, but bringing to your attention her 2010 study that stress reduction correlates with structural changes in the amygdala. This made a bit of a splash even in the public's mind, because Dr. Holzel was basically determining that people who felt less stressed after their MBSR program, they filled out symptom self-reports and indicated that they were perceiving a whole lot less stress than when they started the MBSR program. Well, they had a lessening in the size of their amygdala. The amygdala is well associated with the stress response. When we're feeling fearful and stressed, odds are very good that our amygdala is activated. Well, after only an 8-week program, there was a reduction in the size of the amygdala, and this was associated with individuals who said that their perception of stress had lessened. Dr. Holzel followed that up with further studies, with a further paper, in part related to the group who had attended and been study for the first paper. Okay, she combined two groups when she was looking at the response of the amygdala to MBSR. And then with her, that subsequent paper, Mindfulness Practice Leads to Increases in Regional Brain Gray Matter Density, she honed in on the range of different changes in response to mindfulness. She was not looking only at individuals who found that their stress levels had been decreased. I bring that third study to your attention, coming to us out of Siena in Italy. Now, mindfulness has really captured the imagination of researchers really globally now. I understand it's now being taught and researched in China. But here is a researcher in Italy who, a very interesting study, very recently published, 2015. They discovered that individuals who attended an MBSR program had changes in a brain region called the insula, and the insula became larger, and they were people who at the same time were becoming more aware of their emotions. So they had less alexithymia, is the psychiatric term. Individuals who had less alexithymia had larger insula. Pardon me. So let's settle now into our neurological conditions which have brought us all here today. And we'll look now at some of the studies looking at mindfulness as an aid for people living with multiple sclerosis. And I bring to your attention the work of Dr. Paul Grossman. Dr. Grossman's work is well respected by his peers. His studies are well designed, and his analysis of results is clear, and it has integrity. So let me tell you about this study he did back in 2010. This was a big study, folks. I'll get to the next slide and show you. He invited 150 patients with MS, both relapsing, remitting, or secondary progressive, to participate in his study. One half of the participants were in the control group, randomly assigned to a control group, and the other half experienced, again, the 8-week MBSR program. He modified it slightly. He called it a mindfulness-based intervention based on MBSR. And his participants filled out a range of self-report measures. Dr. Grossman was especially interested in health-related quality of life. He maintained that that was being overlooked in the treatment of multiple sclerosis. There was, of course, much focus on affecting the disease outcome, quite rightly, but he offered that people living with multiple sclerosis often had psychological issues to deal with. Let me just get a quotation for you here. He observed that sometimes the treatment for multiple sclerosis seemingly had little effect on the psychosocial experience of the condition. And in some cases, the treatment can even seem to worsen the psychological psychosocial condition of patients. So that alongside the physical complaints, many patients with multiple sclerosis have substantially impaired health-related quality of living. They live with depression, fatigue, and anxiety. Let me tell you a little more about this population. I'd like to emphasize it for you because this study was so well designed and it's a large population. Coming to us, by the way, out of Switzerland, Basel, Switzerland. Individuals in the study had had no more than 2 exacerbations in the past year. Okay, so those living with relapsing and remitting MS had had no more than 2 exacerbations in the past year. and their EDSS was less than or equal to 6. Okay, so some individuals had minimal impairment, others could be classified as having a moderately severe physical impairment. Let's look at the results he found. So really, across the board, all the psychological measures showed significant improvement. And again, we're comparing now to the other 75 patients who were in the usual care group. And he followed up for 6 months. Again, a well-designed study. He didn't just look at the maybe the first week or two after the MBSR program. He invited participants to come back 6 months later. Not only did they have an improvement across all these psychological self-report measures, but very interesting their amount of home practice correlated with these improved measures. Ladies and gentlemen, an MBSR program is very challenging. Imagine practicing an hour a day. Not everybody has the stamina for that. And he found that individuals who were indeed able to practice more seemingly had a correspondingly improved outcome. So their psychosocial measures were improved, apparently in association with the amount of home practice. I think Dr. Jacqueline was emphasizing that too. It really does take a bit of effort, a bit of time. And further, Dr. Grossman was not surprised by this, there was no improvement in upper and lower limb mobility. It's interesting, these are early days. Think of, it's only been 15 years really that we've been researching. It may be that the psychological measures respond first. We don't know yet. I'll show you another study or two that suggests that there's room for physical improvement through mindfulness too. But Dr. Grossman is very cautious, very conservative in his interpretation. And he would offer, hey, people were happier, they were sleeping better, their health-related quality of life overall was improved, and this matters. Here's another study I bring to your attention, coming to us from London, England. It's a smaller study. This is a notable study, folks, because it's done through Skype. Okay, we're making use of modern technology. Dr. Carlson out in Calgary has also worked with patients recovering from cancer through Skype. Okay, so we're talking about video conferencing now. But it was the same 8-week program, or not the same, but it was an 8-week mindfulness-based intervention. And these participants had been diagnosed with primary and secondary progressive MS. They too completed self-report measures at baseline, post-intervention, and there was a 3-month follow-up. The distress scores were significantly lower in the mindfulness-based intervention group. And the mean scores for pain, fatigue, depression, and impact of MS also improved. Here's an interesting study offered to us by a naturopathic doctor in Oregon, Dr. Senders. What she and her colleagues did was a statistical analysis. And she found that there was a correlation between what you could call trait mindfulness and, again, measures of perceived stress, coping, resilience, psychosocial measures. Now, trait mindfulness, folks, is not something that people taught you, although maybe they taught it to you at one point, but now it's so much a part of your personality that when you fill out the self-report measures, hey, you're just someone who responds to life in a more mindful way. So she was not looking at the outcome of attending an MBSR program. She was, however, looking at trait mindfulness. You could call it dispositional mindfulness. And there's the measures that she analyzed. That top one there, 5-facet mindfulness questionnaire, it's a pretty popular measure of mindfulness. And then below that, you see 4 measures of psychosocial issues. And Dr. Sinders determined that trait mindfulness, as I mentioned, it measures the tendency to be mindful during everyday life. And it's measured, as I say, by the 5-facet mindfulness questionnaire. She determined that having greater levels of trait mindfulness is significantly associated with decreased psychological stress, better coping, increased resilience, and a higher quality of life. So just tending to be mindful, it tends to help one's psychological experience. There's a lot in that too, isn't there? Now let's look at this was a literature review and a meta-analysis. Clinical utility of mindfulness training in the treatment of fatigue after stroke, traumatic brain injury, and multiple sclerosis. So the researchers examined 372 unique articles. They focused in on 4. And they concluded by reviewing these articles, and if you're interested, I would encourage you to check out the study itself, look through the bibliography. Our results suggested that mindfulness-based interventions have the potential to relieve fatigue in neurological conditions such as stroke, traumatic brain injury, and MS. And some of you may know better than most how frequently MS is accompanied by fatigue. Some studies suggesting that that is a principal complaint for more than 50% of patients living with MS. And well, we'll just skip that. You can read that later if you want. Let's move on. Mindfulness-based stress reduction in couples facing MS. So let's not overlook one's partner. This is a very interesting study, I thought, by a lady working on her doctorate. She invited 25 couples, one partner with relapsing remitting MS, to attend an 8-week MBSR program. And she found that there was a positive change, not only in the patient's well-being, but also in the partner's well-being. She offered that the intimate partner is participating in the disease process. And sometimes there can be considerable relationship strain as an outcome. And she discovered that not only were the patients helped by the MBSR program, but the partner's levels of anxiety and uncertainty were improved. And further, they reported a more satisfying relationship. And of course, that has implications for the progress of the illness too. The less stress, the more satisfaction one has in life. Seemingly, the disease is quieted. But I'll leave that to other clinicians to comment on the effect of stress in MS. Here's a study I'll quickly bring to your attention. 2 Welsh psychologists. Part of why I enjoy reading this research, ladies and gentlemen, is by and large the scientists are also practitioners. There's a lot of heart in their papers, and you can see that they are adapting mindfulness to meet the needs of the people who are coming to them. And these 2 Welsh psychologists developed a program of mindful movement. So here's another mindfulness-based intervention. It's a very interesting study. You can, again, check it out, download it if you're interested. And we're looking at 8 participants. So it's a small study. It's, as they say, a pilot study, who had secondary progressive MS. And they received 6 individual sessions, so it was standardized. They received 6 individual sessions. I suspect it would have been weekly, but I was not there. And as well, participants were invited to practice using audio and videotape aids to practice mindfulness-based movement. At the conclusion of the study, the participants were assessed on a test of balance. That was an objective test. And also, there were psychological measures too. They completed self-report measures of 22 symptoms relevant to multiple sclerosis. So it's interesting, this was a movement-based intervention, and yet the psychological measures were also responding. And you can see the final paragraph there. The mindfulness group showed improvement over a broad range of symptoms, and this was verified by the relatives' independent rating, and it was maintained at a 3-month follow-up. Valuable to see that the objective measure there. Dr. Grossman, in that earlier study I was telling of, comments that he regrets that in his study it was necessarily symptom self-reports. Patients were reporting on their own experience, and he, as he analyzed his results, prophesied that we would need more objective measures too. And here's a study that does have something of an objective measure, other people watching the patient and determining how their balance is. Now let's move on to Parkinson's disease. I have 2 studies to bring to your attention today, but that's deceptive. They are by the same researcher, and further, they are the researcher looking at the same population. Okay, so Dr. Pickett, I hope I am saying Dr. Pickett's name correctly, is offering us this study from Belgium, from Antwerp in Belgium. She enrolled 14 patients with diagnosed Parkinson's disease for yet another 8-week mindfulness-based intervention. And of course, there was a control group receiving usual care. And she obtained MRI data sets, okay, doing an MRI before and after their participation in the program. And she looked in particular at the gray matter density. Okay, so that's something like what Dr. Lazar was also looking at in that second study that I told you of. And Dr. Pickett determined that there was increased gray matter density found in the mindfulness group. So the people who had been practicing for 8 weeks, they had increased gray matter density in the neural networks that have been postulated to play an important role in Parkinson's disease. This is fascinating, really. Okay, we looked at, I believe she came out, she discovered that the hippocampus was larger, and there was also an increase in the functional networks mediating the benefits of meditation. There was overlap with the decline that occurs in the brains of patients with Parkinson's disease. So these areas have also been implicated in Parkinson's disease, and they were responding to mindfulness-based stress reduction. Let me see if I can find that quotation. I know there are clinicians in the room who might be interested in exactly what regions of the brain seem to be responding. Yes, here it is. It's the bilateral hippocampus, both right and left, and also a small region in the right amygdala. And smaller hippocampus volumes have been reported in Parkinson's disease patients, so that is possibly part of the disease process. And here, through the mindfulness-based intervention, there seems to have been some reversal of that. And further, she noted that there was a decrease in the gray matter density of the amygdala, which has also been reported to be affected by the process of Parkinson's disease. So typically the amygdala has a lessening of volume, and patients attending the program had an increase. That's interesting because it stands in contrast to what Dr. Lazar found in the study I was citing earlier. Let's look at that second paper that Dr. Pickett offers us, again looking at the same group that attended the MBSR program, or mindfulness-based intervention more correctly. Here's her second paper, and she determined that the Unified Parkinson's Disease Rating Scale, UPDRS, the motor score on that rating scale, had improved in patients who had attended the program. And what's significant here, folks, is that this was assessed objectively by a movement disorders specialist who was blinded to the status of the patient. So the control group had a worsening by contrast. So the patients the participants more correctly, who had attended the mindfulness program showed an improvement in their UPDRS motor score. And, you know, a change of 5 points on this score is usually considered the cutoff score for clinically meaningful improvement. So here we see more than 5 points. We see 5.5 points. And as she commented in her paper, this change is within the moderate range of clinically important differences. Now, again, let's not overstate this. Parkinson's disease, we know, is sensitive to what we tend to call the placebo response. The brain can respond to hope and trust by changing and even temporarily improving function. So the author cautions that future studies require a longer follow-up, and further, they require a validated active control group. Dr. Grossman was also calling for this. Rather than having our control group simply be folks waiting to attend MBSR, he said, and Dr. Pickett is confirming, we need control groups where people get together and they socialize and they talk about their condition and so on, but they don't practice mindfulness. That way we can be more specific. Is it the mindfulness that's bringing these changes, or possibly it's other factors, less, or we could say non-specific factors? This work is still to be done. And moving now to cognitive impairment and dementia. A couple of studies talking about meditation and neurodegenerative illness and aging. The trouble with these studies, folks, is they're talking about meditation in that generic sense. Remember I said it's like athletics? So they're interesting studies, but they're not about mindfulness per se. There's some mindfulness mixed in there, but it's not well addressed. Here's another study. You see, they're all coming out the same year. Goodness sakes, 2014, people got it in their minds to investigate meditation and cognitive decline. Here's another study. I highlighted it for you because it features Dr. Holzol and Dr. Lazar, two of the researchers I brought to your attention earlier. And they are also looking at the potential effects of meditation on age-related cognitive decline. But again, this is a mix of different meditations. Let's move right into mindfulness. So the potential benefits of mindfulness-based interventions in mild cognitive impairment and Alzheimer's disease. Dr. LaRoche is a Quebec psychologist, and he's written, I think it's a fascinating paper. If this is a topic that interests you, I can recommend Dr. LaRoche's paper. It's not research-based in that he didn't perform any MBSR groups, but he looked very closely at the research literature more broadly, and he is highly recommending that we consider bringing mindfulness-based interventions into the treatment regimen of people who are worried about cognitive decline. Now here are some studies that go further. One, we're going to wait for the results on this one, folks. It's coming to us from Australia. And the researchers there have designed, from what I can see, an excellent study, but we've got to get the results. Looking at how mindfulness might improve the cognitive function, psychological health, and so on, of patients living with mild cognitive impairment. But the results, maybe next year, maybe they'll have something for us. And this is a very small study, but what Dr. Wells has shown us is that there is a kind of neural basis to suspect that mindfulness could help patients who are susceptible to dementia. She taught an MBSR group and determined that there was improvement in the hippocampus and the functional connectivity of the brain in those same regions that tend to be deteriorating in the process of cognitive decline. Fascinating. But it's a small study. And a further study looking at mindfulness-based interventions helping older people who are worrying, who are ruminating. This is a risk factor for cognitive decline. And participants, 34 of them, attended a mindfulness-based program and were followed up even 6 months post-instruction. And they reported a decrease in their worrying and an overall improvement in psychological matters, even very suggestive there, some improvement in memory, folks. Still early days, but suggestive results. And they're bringing in the caregivers again. And this is my second to last study. I'll just ponder it a bit for you. Biomarkers. This is where the research is headed now, folks. As I mentioned when I started my presentation, we're becoming very interested in the biological consequences of attending a mindfulness-based intervention. How is the body changing? Certainly we see that in the neuroplastic changes that I was pointing to. And further, here's a study, I'll summarize it for you. Our studies, I'm looking at the second paragraph down, our studies identified a panel of 194 MBSR responsive genes. So the researchers took peripheral blood mononuclear cells and analyzed which genes had been turned on by the participants' experience of an MBSR program. And functional analysis revealed that these genes were enriched for cellular pathways pertaining to inflammation. We were hearing of inflammation earlier. Here we're possibly looking at, shall we say, a biological mechanism for the value of mindfulness in even immune conditions. I could have presented another hour on that one, but here, really cutting edge, 2016. Our evidence suggests that the benefits of MBSR training could be derived in part by modulating processes underlying inflammation, as well as the stress response and depression. And the final study here, inspiring study, heartwarming. These researchers taught mindfulness to adults with severe speech and physical impairments. Again, it's an exploratory study. 7 adults who were so impaired that they were unable to be understood for the most part. Their speech is understood less than 25% of the time, and or they had severely reduced hand function. So certainly significant communication problems for these individuals. They participated in the study, and there's the summary. Qualitative reports were overall positive. People were keen to practice, and they reported that they would like to practice more, And so it's early days, just coming out last year. Who knows what the future holds for us? So that is the conclusion of my talk. I hope that that was useful in some way. And I do invite you, if you're interested to read further about the studies, you could check out our listing at the website, or of course go to PubMed directly if you're familiar with that website. But we do have all the research papers listed in the appropriate year, categorized according to their year of publication. Thank you for listening.